Case entry is the first level of triage when a caller activates the 911 system. This is when our clock starts for quick advanced life support intervention. The echo level responses are designed for early recognition and immediate response to extreme breathing conditions and other dire situations. To determine if these responses are applicable, we need to understand exactly what happened to the patient. The Echo Situation Pick List assists us in assigning the appropriate response and providing the appropriate instructions for these situations. Let's review a few of the more commonly used echo responses. Remember, not all echo responses are sent after asking, "Tell me exactly what happened." Allergic reaction, breathing problems, lightning strike, or electrocution are a few examples of echo level responses that are initiated after completing case entry. The echo send point for obviously not breathing and unconscious applies only to non-traumatic medical arrest situations where the caller spontaneously provides information indicating that a patient is unconscious and not breathing. There can be no scene safety issues or mechanism of injury concerns to select this pathway. For example, the caller says, "I can't wake up my grandma and she isn't breathing." The goal of a non-traumatic, workable medical arrest is to start CPR as quickly as possible. After sending a 9 Echo 1, we will begin to provide the appropriate pre-arrival instructions to start CPR. Because PAIs are provided immediately, we need to ask how old is the patient and then proceed with the CPR instructions. Now let's review an echo level response for choking. When the caller reports that a patient is choking, we must verify if it's a complete obstruction by asking, are they breathing or coughing at all? If the caller is unsure or not right with the patient, advise them to check and inform you what they found. If the patient is unable to talk, breathe, or cough, select Verified Complete Obstruction and send an 11 Echo 1 and provide the case entry dispatch instructions. Remember that back slaps are not recommended in the dispatch environment due to the increased risk of injury from overly forceful or misplaced blows from an untrained caller. The echo level response for narcotic opioid arrest decreases the time to definitive therapy by initiating early Narcan intervention and chest compressions. When a caller describes a situation where the patient has taken narcotics or opioids and is now unresponsive and not breathing, select narcotic opioid arrest and initiate a 23 Echo 1A response. The echo level response for hanging is used when a caller reports someone hanging who is not obviously dead or when someone has been found hanging and has been cut down. After initiating a 9 Echo 3, provide the appropriate PDIs. "I'm sending the paramedics to help you now. Stay on the line." Cut them down immediately, loosen the noose, and tell me if they're breathing. After sending an echo response, continue through case entry to gather the patient's age and verify if they are awake and breathing. Select the appropriate incident type based on the details gathered during case entry and instruct the caller to locate an AED. Instructions for ventilations first will be provided. Remember, when providing instructions for ventilations first, instruct the caller to provide 2 breaths and then 30 compressions. Once the compression monitor reaches 30 compressions, hitting pause for breaths will display the next set of appropriate instructions. If the patient attempted suicide by hanging and is down and breathing, use Protocol 25 to address potential scene safety issues. Thank you for watching. Visit our website and YouTube channel for more CDEs.